Hello, everyone, and welcome to the Oklahoma News Report. I'm Rich Lenz. While the arrival of 2 COVID vaccines is a sign of progress and hope, there is no question the virus is as rampant in Oklahoma as it's ever been. Last Sunday, the state shattered its previous one-day total for new cases, with 6,487 new cases in a single day. Not surprisingly, our hospitals and their staffs are being stretched and stressed like never before. Rory Taylor reports on how state facilities are coping with the expected holiday surge now taking its toll.
This COVID is not like the flu. In my entire career in healthcare, we have never had to plan for the flu by counting intensive care unit beds and worrying about transferring patients out of state.
For the last week, Oklahoma's hospitalizations have run just under 2,000 cases, putting us well into Tier 3 of the state's COVID hospitalization surge plan.
I am very worried about this because all the way through this pandemic, when we see an increase in positive cases, within days, typically 2 weeks, we see an increase in hospitalizations. Since the holidays, we have seen increases. And so we know the next 30 to 45 days, based on the positive rates that we see today, are very troubling to us.
And the consequences for that upward trend might begin to affect not only COVID care, but the care for all patients in Oklahoma.
At Integris, we are experiencing basically at capacity numbers every day. It's sort of a one in, one out situation. We are doing our best to move patients around. But every day it's sort of managing what's coming in our door. We are having to make decisions about surgeries that we hoped we would never have to make.
Hospitalizations due to COVID peaked on January 10th at 1,926 patients. ICU patients peaked 3 days later at 477. Between those and non-COVID ICU patients, the State Department of Health reports Oklahoma currently has just 5% of its adult ICU beds available.
If you were a restaurant and all of a sudden you were flooded with 40% more customers and had the same staff, that would be distressing. That would be challenging. Hospitals, just their normal operations are to try to anticipate the volume, match the staff to the volume. In this case, we've been at this for months, and we've done everything we can to bring in staff.
Oklahoma currently has about 700 nurses per 100,000 people. The national average is 1,150, which puts Oklahoma behind by about 28,000 total nurses, a staffing deficit worsened by COVID.
This virus is very contagious, and as our healthcare workers get exposed and become positive, we have to send them home. So all hospitals are struggling with healthcare professionals that are quarantined right now, coupled with the fact that we rely on staffing agencies for nurses. When we're not in COVID time, we are in COVID time now, and we are competing against other states for nurse staffing.
Of course, efforts are being made to help mitigate the problem. OU Health and the OU School of Nursing have been working together to get nursing students into the field.
Last spring into the summer, we came together and developed a pilot program that we offered to senior level nursing students at OU College of Nursing, where they would be employed by the hospital system, OU Medicine, and during their employment would also achieve clinical credit for their work.
The Nurse Workforce Initiative helps students establish connections that hopefully keep them in Oklahoma. And with the new semester, the program's initial success means further expansion.
We're expanding that program into the spring semester, the final semester for these students, and we're growing the number of students from about 35 to 50, and really excited that looking forward for them to have a very positive experience in their final semester of their senior year. And our intention is that translates to full-time nurses that join us after graduation and once they receive their nursing license.
The governor's executive order in March that allowed hospitals to employ nurses waiting on a license has also relieved some of the tension. But with 10 times more hospitalizations than the state had when that order was passed, hospitals must take potential crisis standards into consideration.
This is not just about COVID patients. We don't take COVID patients off to the side and say, okay, we only have one ventilator for the 5 of you. That's not how this works. Crisis standards of care are invoked across the board so that in that kind of horrific future that we're doing everything to avoid, it would be applied to everyone in the emergency department, whether you are coming in for a heart attack or a car accident or COVID. The crisis standards of care apply to everyone.
The only way we stem this tide is to stem community spread. That is the only way.
Rory Taylor, The Oklahoma News Report.